to go.
This meeting is being recorded.
Where the world is changing fast. And here from the UK, there is a big document, a policy document looking at 2030 India-UK relationships, and Ayurveda appears in that. I will share the screen. So there are many positive things going on, but there is also a lot of ignorance in society, not only outside India, but it seems the biggest enemy is within India.
Yes.
So we are looking to hearing from you about all these matters. And Deepika ji is here. She has lived in UK. She has been connected with early efforts to grow Ayurveda in the UK, and she will tell us about the resistance.
Doctor,
And perhaps
let us
also,
start, sir. Sir,
Yes.
start करें?
बिल्कुल जी.
आज मैं ही start करता हूँ, sir. Okay. Namaskar. Good morning to all viewers. Friends, today we have a 12th lecture on virtual lecture series on pharmacological and therapeutic effects of 75 Ayurvedic medicines. And today our session is on Trikatu Churna. We have two special guests, Dr. G.G. Gangadharan ji, who is a director in India in Ramaiah Indic Specialty Ayurveda Restoration Hospital, Bengaluru. Namaskar, sir. Welcome. And we have Dr. Deepika Gunwanji. She is a medical director, Integrative Medicine, Max Super Specialty Hospital, New Delhi. Welcome, Dr. Deepika ji.
Namaskar.
And Namaskar. We have two expert speakers, Dr. N. Sujata. She is BMS, MD, PhD, and working as a professor and head of department in Patanjali Bharatiya Ayurvigyan and Anusandhan Sansthan, Haridwar. And we have Dr. Dhanada Kulkarni. She is the president of Texas Ayurvedic Professionals Association and board of directors of NAMA in USA. Welcome, welcome. So all our speakers will enlighten us about the pharmacological and therapeutic benefits of Trikatu Churna. As we all know, Trikatu is a combination of black pepper, long pepper, and dried ginger. And it is used in many Ayurvedic medicines. And it is also used independently by many traditional Ayurvedic practitioners for many ailments. So without wasting any time, I'll invite Dr. Madan Thangavelu to moderate the session. Welcome, Dr. Madan Thangavelu.
Harish ji, namaskar. Thank you again for bringing all of us together today. I hope you can hear me clearly. Thank you, Harish ji, for bringing all of us together. We are on to our 11th session in this series looking at traditional Ayurvedic medicines. Now, I want to emphasize a little bit on the terminology that we've used and to see how we can connect it with the global moods now about traditional systems medicine. India recently announced the establishment of a global center for traditional medicine for the World Health Organization. So that is a re-emphasis on that word, traditional medicine. And the traditional systems are, of course, many across the world, and there are many different interpretations of what is traditional medicine. Now, what is becoming clear is that in India, where these different systems have operated for thousands of years, people have understood very clearly what these traditional systems are and how they are used. And we are very fortunate to have two extremely knowledgeable people, very senior people here today with us. Welcome, Deepika Gunwanji. Deepika has clearly studied Ayurveda in India, and she has worked in UK and works now in Delhi. We are also very, very fortunate to have Professor G.G. Gangadharan here with us. I have known G.G. for a decade and perhaps a little more than a decade. Gigi, I continue to admire Gigi as a person who really appreciates the depths of Ayurveda. Not only that, but he also is deeply connected with how to get Ayurveda into the public health domain. And in one of the World Ayurveda Congresses World Ayurveda Congresses that was held in Bangalore, Gigi presented very, very eloquently on how Ayurveda can go and provide a correct interpretation of that word public health. And in his talk, he gave us many, many references to mantras from the Rig Veda about how we could live for 1,000 springs, etc., 100 springs, etc. And also he mentioned in his talk about a very important book by Kai Kalang. Gigi will tell us about this book. Gigi, welcome. So, thank you. Thanks. Yes. And Arogya Kalpadurma, I think that is the name of the book. And Gigi emphasized how if we look into this book, you can really get the essence of all the dimensions of Ayurveda, including how it can be used in public health. We are delighted, Gigi, you have taken time to be here with us. Thank you, Deepika, for joining us today. I just want quickly to see whether you are appreciating our emphasis on that one term, traditional Ayurvedic medicine. The motivation comes from the fact that Canada recognizes that phrase, traditional medicine, in a very open way that we don't see many other nations of the world recognizing. Gigi, you have a lot of experience in not only in using Ayurveda in its fullness in India, but you also have spent time in Canada. You have a Canada connection from doing your PhD here in Canada. I would love to hear whether we are thinking about this correctly and whether we are moving forward in the right direction in highlighting traditional medicines that are used in a very specific way, have been known for thousands of years, continue to be used and continue to be effective. And perhaps you could tell us a little bit on what is in your mind. The same for Deepika ji. Thank you. Gigi, you have to, you're muted.
First.
Thank you.
Yeah.
Thank you.
Sorry, I would like to know the way this, I'm sorry I didn't see the earlier one. So I was under the impression that there'll be a presentation of Trikatu, its users. Then will the panel will start discussing on
sorry,
that.
Gigi, let me take you in. The way we have 30 minutes of open discussion. It's a socio-techno-political kind of discussion. So it's a very open-ended discussion where we want to think about the traditional medicine, and we'll have yourself and Deepika ji. And then we have the two presentations, and the two presentations are in the form of a Dravya Guna person initially, and a Kaya Chikitsa person to follow on, to tell us about the ingredients and how it's to be used. And finally, we open up, and we try and keep it to about 90 minutes so that we can have very intense, compact discussion. So Gigi, the first 30 minutes is for us to open your mind, to tell us about what is in your mind, where is Ayurveda going in terms of traditional systems, where do you want it to go, because you're one of our senior mentors and leaders in this space in India and around the world. Where do you think?
Thank you, Madan and others. I am extremely happy that I could be a part of this, even though it was represented to me many times before, also I could not join. And I understand that International Ayurveda League has been doing a very good work of getting people together and trying to see how the knowledge which is scattered in different areas of expertise is getting some way exposed to in a usable manner by many people who are interested in Ayurveda. That's my first remark. Coming to the point of discussion of Dr. Madan, I feel there is, I appreciate the efforts of WHO, governments like Canada, in other countries also, which are open to Ayurveda. But the catch I see in the nomenclature, the traditional word is little of concern to me, because it somehow implicates that it is not scientific. That is the problem I see, because traditional means it has come, as you see in the definition of WHO given traditional, etc. It is coming from generation to generation. But Ayurveda, I think there are no parallels like Ayurveda in other countries other than Chinese system, because the written tradition in India is so strong and so coherent. And it is not a science came out of the blue like other systems, including Chinese system. This Ayurveda has come from a profound scientific basis based on the philosophical environment of India called the Shad Darsanas. So it is a science itself with a different paradigm. So this paradigm connection is not understood by many or most of the Western open-minded scientific world. That is the catch we have. So even today, there is a kind of empathy or a sympathy towards a science, which has contributed a lot to generations after generation, maybe more than 5,000 years. That is good. But what people even today lack is the understanding of its scientific basis, which can give rise to many sciences of other origins. For example, I want to quote here, no, it is Ayurveda is one of the sciences in India, which is very active even today. But you see, all other sciences like the metallurgy, like the even the humanities, areas of humanities, areas of arts, areas of agriculture, all these sciences, we see a very solid scientific basis. This scientific basis only can grow Ayurveda further. You can see there is a definite decline of growth of original thoughts in Ayurveda after 17th century, especially after Shankara Samhita. Then we have got a lot of Nikhandus, but not classical texts. And if you look the pattern of the classical texts of this country, from Rig Veda to Yajurveda, which is the roots of Ayurveda, origins of Ayurveda. But if you came to the classical tradition and scientific era of Ayurveda, is that Susruta, Charaka, and Vagpada, and Madhava, and Shangadhara. These are come out of the original science of Ayurveda based on the Panchabhautik principles, which governs all the sciences of that is of Indian origin. So when you call traditional medicine, you are putting it under a bracket of many other sciences which are not so profound and which you don't see a reason to generate further offsprings from this science using its own foundations. So the foundational principles, the categories, all the methodology that is used in Ayurveda is very, very, very important for Ayurveda to grow. For example, last 50 years, if you see with all the people who are open-minded for Ayurveda to embrace for their growth, are trying to take parts and aspects of Ayurveda rather than Ayurveda as such. So when I say Jagatteva Manaushadam na Vidyat Kinjil Vasar Nanartha Yoga, it has got a great implication. So if you say the traditional medicine, how can I use a plant in Russia, a medicinal plant, herbs in Europe, a medicinal herbs without having an understanding of its basic utility as a medicine, how the rishis started using it. So this kind of growth is completely lost when you just regard it as a merely traditional medicine. So this is my take on this. It's very important that especially the Ayurvedic community should emphasize. I at the same time, it is not a thing that we deny their acceptance or we are egoistic about. It is nothing like that. I am just only making scientific, what do you call a presentation of the need of understanding Ayurveda from its roots. Then only it will grow. And I am giving an example that there are no original works based on Ayurveda to come out which can use these Ayurvedic sciences further. And I feel, I hear people like Kishore, people are feeling with little, they feel apologetic about some scientific aspect, but these roots are not embedded in their learning. So once these roots are learned in their learning, this outlook will change. How Arogya Kalpudramam came in 14, I think around 18th, 17th century. The reason is that this is a classical text like Shargadhara Samhita to some extent, even though it has taken many other areas, but it has gone deep into the basic premises. See, the Kushtaroga, so far only 18 diseases were explained by Sushrita, Charaka, and Bhagavata. Suddenly you got 120 types of skin diseases. And each skin disease are explained with its symptoms, signs, prodromatic symptoms, and how it can be treated, the methodology. That is Ayurveda. So can we have such science if you do this kind of categorizing Ayurveda to traditional system? This is one point. Second point is that we tend to deny the need of communicating with other sciences, especially modern biomedical sciences, modern biochemistry, and other kind of science, which can get into the roots. For example, I'll give you my 2016 November work, which was published in Nature, which really clearly correlates the scientific basis of Prakriti. And it said there are 52 genes that can be unique to a nature of Kapha Prakriti person. So how it came? So if there is no scientific basis to the theories of Ayurveda, we can grow further. And Ayurveda has been always evolving. That evolution of Ayurveda will come to a stop if you don't understand this thing. If you see the historical evolution of Ayurveda, till Ravana's time, there was no Arka at all. Arka was a dosage form given by Ravana's contribution. And there was no use of any kind of minerals and metals till it came only after 2nd, 3rd century in Ayurvedic classics, because they are absorbed. How could they absorb it? Because they could connect it with the Vata Pitta Kapha principles, Panchavadic principles, Shida, Ushna principles, Doika principles of Ayurveda. That's the basis. Ayurveda goes beyond Tridosha, beyond Panchabhuta. Actually, it starts from the Ushna Shida principles. That Ushna Shida principle is a great principle which people, scientists in the forerunning areas of research is trying to find out how it can be. So every life system, if you see the osmotic changes, if you see the digestive changes, if the metabolic changes, everything is depending upon the balancing of the Ushna and Shida in the body. We all look at electrolytes. So there are so many connecting points. Unless we understand this Ushna Shida principle, this cannot be understood in the detail. So my take to your question, which I don't want to get into others' time, but the problem with us is that we don't have a sound basic premises understanding to correlate with other sciences without distorting the principles of Ayurveda. We don't have to be apologetic about our scientific tradition. We have to profound. The only thing is we are not able to. One of the reasons for that is that you see the earlier way of learning Ayurveda is not just jumping into Ayurvedic text the first day. There is a premises being created in the minds of the disciple to get the Ayurvedic paradigm in his mind properly stamped. How they have been doing it? They have been doing it. Sahityam has been taught, Vyakarana has been taught, Darshanam has been taught, the literature and how everything is connected, that has been taught. Then only they are taken to Ayurvedic. So if you look into any text formation also, these foundations are laid in the first phase of learning. This is completely lost. And one of the killer of Ayurveda is today's Ayurveda education, because they distort the science into different subjects. See, how can you take Dravya Guna from basic Maulika Siddhanta? You cannot divide. Dravya Guna is the offspring of Maulika Siddhanta. And Dravya Guna is not a science. It is only a technical part of Ayurveda, nothing to be learned. It is only to be by-hearted. What is there to learn in the Dravya Guna other than by-hearting, understanding that particular plant, how it works? That's all. But if you go beyond that, then there is something else. So let us make some kind of effort at a very, very, very long-term level, that founding the basic premise of Ayurveda and then only trying to correlate. There is no need to correlate immediately the day one. Correlation will come as an outcome. But if you do this one, all the sciences, not only Ayurveda, our metallurgy, our agriculture sciences, our sciences and our music, our dance, everything is based on this science, which is the foundation of Ayurveda.
Gigi, you are very
So
special. You are very fortunate because you have a mother who is a Sanskrit scholar. You went to a school where you learned your Ayurveda out in the forests. So not many people have that privilege, but you're correctly touched at the very end, saying there is a difficulty with education, and that education, the formation of the mind, the Vaidya's mind, is a process that needs to be done differently. Now, whether that can be implemented in the mother country, in India, and elsewhere is a big question. And I'm so happy that you are here with us. You are so clear in how you opened up this space. Please let us hear a little bit from Deepika ji, and then perhaps come back to yourself, sir. Deepika, namaskar ji.
Namaskar.
Deepika ji, thank you so much for being with us today. You can see the kind of argument that is being posed by Gigi, and where do you think you fit into this kind of line of approach? Do you agree? Do you disagree? You see different needs?
Well, the question that you posed is that whether traditional medicine is the right way to define Ayurveda. Am I right in getting that?
Well, we have, let me say, the reason why we have chosen, I'm tempted sometimes to use the expression used to describe traditional Chinese medicine. So the three words strung together gives it a form. And we are saying, why can't we capture that form for Ayurvedic medicine? Why don't we, instead of TCM, could we have TAM? Number one. Gigi's point is a very deep analysis. He says, prefixing traditional there might give people the impression it's not scientific, which is...
Well, I personally don't 100% agree with Gigi on that. We don't have to be apologetic that it's traditional. It is traditional, and we know it's scientific. But of course, we didn't have those scientific tools available, but we can explain them in the light of modern equipments or modern modern technology now. Like we are going to talk about Trikatu today. Trikatu has been a part of Ayurvedic medicine way back in the formulations we have seen. On its own, in combination, in other medicines, in traditional medicines. So the blend is always present. Individually also the ingredients are being used. But what I am trying to make a point here is that the Trikatu, why it was in the formulations, today we are explaining in terms of bioavailability enhancer, right? Today we are explaining it as Ampachak, it helps in digestion. Today we have seen it's used in COVID scenarios in the last 2.5, 3 years. So, I mean, there are ways to improve on it. As Gigi also rightly said that we are evolving. So I don't see any reason why we should feel insecure about being used traditional Ayurvedic medicine, because in Europe it's under herbal medicine, and under herbal medicine you have the traditional Ayurvedic medicine, you have the traditional Chinese medicine, and you have the Western herbalism. This is how it is defined in Europe. So I don't see any reason why we should feel a little, if I may use the word, offended about it. It's there, it's traditional, and we should take it that way and then move on with it and say that, okay, it's traditional medicine. And as you said, Canada has done very well. Of course, Canada has done well. But even in Europe, in UK also, we did it. I remember I was part of the Herbal Medicine Regulatory Working Group. We had this group twice, and I was representing Ayurvedic medicine. And we had a whole curriculum prepared for Ayurvedic medicine. So the 2 documents were submitted to the Department of Health UK. This was about 10 years ago. So what I'm saying is things are happening. People are getting to know about Ayurveda. In fact, when I went in 1995, it all started as a mumbo jumbo when the Lords Committee report came out. And then we set up an association. We had our conferences, exhibitions, talking about Ayurveda. Where we have reached today, I think we have come a long way. And therefore, I think we are happy that Canada has taken up all this, and a lot of things are happening. In fact, I was very happy to see that NHPD, they are also talking about Agni. They're talking about Trifla, they're talking about Ashwagandha, they're talking about Ayurvedic pharmacopoeia of India. Similarly, in Europe, I think, initially when Canada started, I still remember when we were doing the THMPD, Canada had started, and Canada had really copied what THMPD was going to do. And today, Canada has come a long way. So things are happening, and I don't see any reason. Well, I don't 100% agree with Gigi, but yes, we have to be careful. We have to get into getting our claims substantiated. We have to get into clinical research. We cannot be saying that double-blind placebo-controlled trials don't work for Ayurveda. If it doesn't work for Ayurveda, then what does work for Ayurveda? Till we find that alternate for Ayurveda, let's do it this way. At least we'll be somewhere. We will be able to substantiate the claims that we are trying to make today. It's very important for us to get going with the times, not sacrificing the, of course, the concepts. I'm not even for a minute saying that we should sacrifice the concepts, not at all. But we need to move on with the technology, which we are doing.
Deepika ji, thank you. Before I think we're coming up to our time where we are going to introduce our expert speakers. But before we do that, maybe very quickly, could you tell us how a major hospital network, Gigi himself is working for a major educational establishment hospital in Bangalore. You are, of course, part of a very large network that runs across India. How does Ayurveda fit into that space? And the reason why I ask this is there is a big network interaction developing in Toronto with something called the University Health Network. It is all the hospitals in the Toronto area that are coming together, interacting with Canada-India Foundation. There is a agreement signed between India and Canada-India Foundation plus the University Health Networks. I want to see if you could guide us somewhere very briefly how Ayurveda fits into the network that you are connected with, and are there lessons for us for Canada?
Of course, there are lessons for us to learn from this. I've been part of a very big network for the last decade, almost 10 years. And we have been interacting with the allopathic doctors, and we understand our limitations, they understand their limitations at times. Now, just yesterday, I was part of a team that was looking at a patient that had a liver transplant, has diabetes, has developed CKD, and therefore his creatinine levels have gone up. And so everybody is saying that we'll have to, so he's on about 14, 15 medications. So what we do here is we interact with these allopathic doctors, and the patient then actually said, okay, just to address my creatinine problem so that my kidney doesn't get any further bad, gets into problems. So what is it that I can do? That's where I intervened, and I said, okay, there are lifestyle changes that have to be made. There is a single Ayurvedic medication, because there are practitioners who are giving medications who may be, harmful for the liver, affect the liver, affect the kidney. So I have to keep that in mind. So we have to be very open-minded and speak to the consultants. If there is no treatment, we say there is no treatment. Because in Ayurveda also, as you know, I was about to talk about this when we were going to talk about Trikatu, there are stages of diseases. Sanchay, Prakop, Prasar, Stan, Sanchay, Vyakti, and Bhed. So we need to understand that a patient cannot come to us in a stage of Bhed and expect miracles from us. It has to be Sanchay, Prakop, and then the treatment starts. Even before the disease develops. We have seen it in COVID times. I mean, when the viral load increases, obviously there are complications. So if the patients come to us in the first two stages, Sanchay and Prakop, when the doshas are aggravated, the treatment is easier to be given, and we know what is to be given. But the moment it enters into the complications, Bhed and Vyakti, then it's difficult. So this we have to bear in mind. And I'm seeing that a lot of patients do come to us when they've already crossed the Bhed stage. So Ayurveda has surgery, Ayurveda has initial treatments. We need to understand that when everything finishes and they know that nothing is happening in allopathic, they'll come to Ayurveda. That's not the way we treat patients. We have to be very open and upfront about this and say, no, if it doesn't work, it doesn't work.
This goes into the world of health literacy and teaching people early on.
Yes, absolutely. And that awareness has to be brought through us, practitioners like us, practitioners like you, practitioners like Harish Verma-ji, and Gangadharan-ji himself has been running such a big institute. He knows if patients come at the last stage, even Ayurveda has stages of diseases, like modern medicine talks about natural history of disease. We talk about this Kriya Kala. So we need to bear that in mind and continue with our work.
We are so fortunate, Deepika ji, that we have both of you here with us, and it fits in very nicely into our wish that we can engage more intimately, more closely, more productively with the University Health Network, the program that is evolving there. In the last 10 programs, we've looked at that aspect, how to come together, India and Canada, in those areas where you can teach each other and learn from each other, more likely Ayurveda informing modern medicine on how to do things. And Gigi, we are looking to both of you, and clearly, perhaps you have something else to add here, Gigi, please. But
yeah,
we are
looking
to both of you to help guide the growth of these early days and early thinking. Gigi, please.
1 minute. I think there is two issues we should address. One issue which I have been telling in many platforms, that Ayurveda as we see today is not the complete Ayurveda. We see through physician like me only 10% of Ayurveda's possibility because of the limitations we have ourselves in, like resources, systems, support systems, so many things, and knowledge also and experience. That's one point. Second point is integrative medicine. I am in integrative hospital, 750-bedded hospital, tertiary care hospital with all most modern affinities and with the best of the doctors available in the state. What I have been seeing is that integrative medicine is not a perfect word to be used today. Integrative medicine is a process, and there is a stage before integrative medicine, something I call it as summative medicine. This was my paper in McGill, which I made, submitted. I published in few books also. Summative medicine is a stage where both system or more than two systems come together without knowing much each other. They do their part and leave, we do our part and leave. Once we understand this process properly, then only integration can take place. For example, there is a condition called, I have treated at least 10 to 15 astrocytoma cases, very rapidly spreading, one of the fastest growing thing. I've been also treating kind of cirrhosis, which is also said to be taken for liver transplant. What we could do is, in this astrocytoma case, which is in the history, one paper I am sent for publication, is that there is recurrence 99% of the time. Recurrence is there even after radiotherapy and chemotherapy, after surgery. Repeated surgery also there. When we intervene with Ayurvedic principles and Ayurvedic approach and Ayurvedic medicine and Ayurvedic changes in diet, at least 5 cases are here with me which have gone more than 3 years. There is one case that is gone more than 7 years without any regression coming back. It's a great achievement. But to continue that, we have to see whether that kind of system can be nurtured. I cannot concentrate on my practice only for astrocytoma. I do so many things. This one is out of that. I am not supported with another system of documentation, still I document that down. So we can do more. So here what we have done is, it's not an integrative medicine to me, it is a summative medicine. They have done their job and given to us, we are doing our job. This is not actually, the integration is when you understand the principles of the both science, how it works, then we can use alternatively both systems. And many times we are expected to come as a last time. When they have nothing to do, they come to us. If something can happen, let it happen. That's not the approach. Like you have been telling, that first 3 phases of disease progression, no? Sanchayam, Pragopam, and Stansam. That area, if we can able to intervene together with the modern system, supporting system, and our mainstream medicine, we can do miracles. So we need one institution which completely devotes this kind of approaches. This kind of university link which Madan has been telling, that's a very good starting point. I am sure There are many areas where there is no infection as the cause of disease, where there is a multi-causal diseases, where there is functional disorders, where there is all system is involved, then Ayurveda only I think can do a lot. And we need support. I do all my diagnosis completed by modern documentation, modern diagnostic. We use it, we don't deny. That is only markers for us. But treatment principle have to be based on Ayurveda. Then this integrative medicine can go ahead. And I am sure once we come with at least 10 such diseases properly documented and published in the international journal, the science of Ayurveda completely will change. And we are waiting for that. I have been requesting everyone, let us dedicate one institution with the 20 years of mandate with divided roadmaps. That's not happening. So let us work towards this. And one of the basic principles of Indian science is not Ayurveda, that Ano Bhadra Kridavo Yandu Vishwada. Let noble thoughts come everywhere. We don't deny knowledge. We don't say awareness is great. This kind of arguments are very, very primitive, and it is not a progressive. So if you are able, but the most important thing of all these things is that understand your science first. Otherwise, that from its root, then only we can build on that.
Gigi, thank you so much. Deepika ji, thank you so much.
Just a small point, Madanji. Madanji, just a small point. You see, you're talking about how we can, have an interface with the Canadian health authorities or the Toronto health authorities who are. See, each country has its own regulations, so you have to work within those regulations and respect the law of the land. So if it is available, and I think Dr. Sharma will be the right person to answer this, I think he is working within those parameters and trying to achieve. So we'll have to do that.
Deepika ji, please stay with us. We'll go to our speakers today. Gigi, please stay with us. But I think we've got a good outcome already. In the first 30 minutes, we have a good outcome, Gigi. I'm going to phrase it. It might be tentative, but I'm suggesting we form a India-Canada collaboration on summative medicine. And we should have inter-country collaboration, Institute for Summative Medicine. And I think this will be wonderful. We will continue this. Thank you for giving us this, sharing this noble idea, and we will use that as one of the outcomes of today's session. Harish ji, you wanted to, it is your large part of this is your thinking. Please tell us if our two very special guests have given us some new directions for the future. I have taken an important one, India-Canada collaboration on summative medicine. Thank you, Gigi.
First of all, thank you very much. Thank you, Deepika ji. Thank you, Dr. Gigi. And I just want to bring 2 points in the discussion. It's a very tricky situation. Everybody says we should modernize Ayurveda. We should make it more scientific. I was in a webinar, I think Dr. Deepika was also there. One scientist raised a question, can we call curcumin Ayurvedic? Now my question to Gigi is, can we call curcumin Ayurvedic? Then what is the point? We are spending so many years on research. We are spending so many years, so many money on this. And then after spending everything, at the end, if any molecule comes into the highlight, comes in research, and we say curcumin has been derived from Haridra Khand. We narrowed down the research, found the active molecule, and finally a curcumin was developed. But now, after development, scientists are saying it's not Ayurvedic. Then where Ayurvedic practitioner will go? This is one point. Now the second point, which I want to emphasize, WHO is recognizing Ayurvedic system of medicine as a traditional system of medicine. I want to share the screen, and then I want to bring these points. There are 2 points. WHO traditional medicine. I want to show the definition of traditional medicine by WHO. This is very important because if you look at the WHO site, you can see the definition of traditional medicine. This is the definition. Traditional medicine has a long history. It is some total of knowledge, skill, and practices based on theories, beliefs, and experiences indigenous to different cultures, whether explicable or not. This is important. WHO is not expecting any scientific evidence from us. This is very important. It is based on practices, theories. Now, if you look at the Canadian government, I'll just show you one more point. The Canadian, if you go to Health Canada, they are also of the same opinion that you don't need any scientific evidence to practice Ayurveda. In Canada, the pathway for recognition of Ayurvedic medicine are different than the routine. I'll show you one pathway, traditional medicine. So if you go to Health Canada website, you can find the pathway for licensing of NHPs. Look at this, pathway for licensing natural health products used as traditional medicine. Now we have experts from America, we have experts from India, UK, Canada, everywhere. This point is very important. Europe, UK, Canada, they are recognizing traditional medicines separately. And if you go to this, I'll show you one point which is clearly written in their website, that we need not to give any evidence of efficacy. If we want to get our product registered in Canada as traditional medicine, now look at this point. Traditional medicine, efficacy should be based on belief systems, theories, and experiences specific to relevant traditional healing paradigm, not on modern evidence. This is very important. Canada is recognizing it.
Yes,
we need not to generate scientific evidence for Ayurvedic medicines. We need not to spend crores of rupees, millions of dollars on research, because at the end, if we will find a molecule, they will say it is not Ayurvedic. It is allopathic molecule. Curcumin is now available in allopathic pharmacopoeia. Ashwagandha extract, tulsi, there are 50 plants from Ayurvedic pharmacopoeia has already been shifted in India from Ayurvedic pharmacopoeia to allopathy. So we need to be very careful where we are spending money, where we are spending time, and where we are going. If we are practicing Ayurvedic system as a whole, as written in Ayurveda text, I think that is the best solution, because even the governments, Canadian government, they are not asking us the evidence based on modern science. They ask us the evidence based on belief, theories, and the experiences, which already we are having. So this is, because this is a, as Madanji said, this is a socio-political platform. And so we are, and I observed the Chinese people have taken advantage of this, and that is why they fix the traditional word in front of Chinese medicine. And that is why they know this, they know the regulation of the word. And now this is how we are now trying to change the narrative of Ayurvedic medicine in West. We are trying that Ayurvedic medicines should be recognized as traditional Ayurvedic medicines. Because if we are doing this, then we don't need we need not to give any scientific evidence with what other people are demanding. Thank you, sir. Thank you.
Even if you say or not say, Ayurveda comes from thousands of years of tradition. There is no doubt. There is no questioning of traditionality of Ayurveda. Only my point is that it is not the tradition that is making Ayurveda what it is, a scientific tradition of Ayurveda in a different paradigm, which is a paradigm which we have been discussing in different forums. And I'm sorry to take more time, but I have to clarify this point to you that curcumin, one has been telling now available arena that the research we are doing in the name of Ayurveda is not at all Ayurveda research. It is helping some other science to get more armory to their use. That's all. If you develop a curcumin from our curcuminoids from our turmeric, we are not being helped at all. So that's how the modern pharmacopoeia itself has come out with larger. Their anti-malarial disease has come from plant. Many of them have come. Even the recent plant also, Artemisia annua came from plant. That's no more used by the traditional communities, used by modern biomedical doctors only. So we should not be, as you told, we should be spending money on clinical evaluation of efficacy, how it can be used by physicians, and treat and train large number of young physicians to use Ayurveda with great understanding and respect. That the whole world will come to you. I have been telling in Ayush Ministry also, let us don't go and beg other countries to accept Ayurveda. You develop 2-3 centers of excellence in India, people will come and ask the government of India, please come to our country, please start a unit in our country, please come, because they are seeking evidence. They are not interested in the modern scientific evaluation of that. They are interested in results. What happened in 1993? You remember when that US, that HDA, US, what is that, DSHA Act came? The Act came because public poured letters to the President's office that we want herbal drugs available to us, whether FDA recognizes it or not. So they developed an identified new category of pharmaceutical things which need not be evaluated by government of US. So all the single herbs are available under US HDA and that HDA Act. That's the kind of what Harish you are doing is we are trying to get an entrance. I respect that entrance is needed. More countries should be using Ayurveda, but that should not be the end. We should know the limitations that these people are giving to us. We should go beyond that limitations and have our own Bhaktitvam, our own individuality, our own scientific tradition properly stamped. Because then only it will grow. I am telling you the history of Ayurveda, how it didn't grow from the modern biomedical and reductionistic approach to Ayurveda. This curcumin kind of thing come out of it. But we don't get a good Ayurveda, which is being perpetuated by our stalwarts.
Gigi, thank you. Your point is very sharp. Noted, Gigi. And
Can I just quickly make a point?
I
think we should. Just a quick one. Harish Verma ji, even THMPD says long-standing history of use. So there is no clinical evidence required, no research backup data required, right? The only point that these people make, NHPD or THMPD or Australia or any other, is talking about good quality products. Mm-hmm. And I think curcumin is a very good example where we have deviated. Curcumin came out initially, it was basically for standardizing the products. That's how it was done. And now things have gone from our hand and it's being, said that curcumin does this, curcumin does that. But the initial job that was taken up for standardizing a product was for its markers. And that is why curcumin and other ashwagandha, vedanolides and others have come out. First thing we must keep in mind that the quality of these products has to be absolutely of international quality. And these markers are only for getting a batch-to-batch consistent product. We should just keep it to that.
Deepika ji, thank you so much for raising this very important point.
We're not going to talk about clinical efficacy or anything. Yeah.
We will now go to our 2 speakers for the day, and time permitting, we will continue this discussion. Gigi. Thank you so much for sharing with such clarity. I mean, you always guide us and you give us such clarity. Deepika ji, thank you so much for offering such clarity to our discussion today, particularly that last point that some of these things demand highest quality standards. We move on to our speaker, first speaker, Dr. Sujata ji, namaskar. Namaskar ji, if you unmute, then the floor is yours. We look forward to, thank you so much for being with us today. We look forward to learning from you. I'm assuming you are today located somewhere in Uttarakhand.
Yes. Yes, sir. I am working as professor in Patanjali Bharati Ayurvigyan Sansthan. It is a massive unit, and Patanjali Ayurved College is one of those enterprise, and I am a professor there as a head, and I have done my post-graduation from Banaras Hindu University from the Department of Kaya Chikitsa, and then I have gone for senior residency as well as PhD from the same university. I had a great experience of dealing with all the Kaya Chikitsa diseases. Even UP is a heavy populated state. We had many acute emergencies as well as the modern, but where the limitations of the modern medicines were there, we used to deal with those conditions, and we had a remarkable outcome with the Ayurvedic system. So I have been into this profession, and I have successfully dealing with my patients. And shall I continue, sir?
Please, yes. Thank you,
Okay,
Sujata ji,
thank you.
and we look forward to learning from yourself.
So today I will speak about my topic, the pharmacological and therapeutic effects of Trikatu Churna. And I thank all the dignitaries on this stage, on this platform, Dr. Harish Verma sir and Pallavi Sodhi ma'am, and all the experts, Madan sir, and for giving me this great opportunity. I have never been into an international platform. This is the very first attempt, and I always request that my mistakes may be ignored and guided properly for my future research also. Ma'am, Deepika ma'am and other Gangadharan sir, I have very much namaskar from my side. Now I would like to continue. So today my topic will be pharmacological and therapeutic effects of the Trikatu Churna. As you all know, in the previous sessions, the traditional Ayurvedic medicines, Trikatu Churna is one of this reputed. It is a great reputed classical Ayurvedic formulation, and it has been used for wide array of diseases. So this potential drug formulation, why we call it, it itself is a great potential drug, a simple drug with no controversies of the availability of the herbs and no controversy of their identification, standardization. So this potential drug formulation is very easy to prescribe and to get from the markets also. This potential is indicated in Agnimandya, Adman. These are the Ayurvedic terms of the diseases where you can correlate also poor appetite, flatulence, and abdominal conditions like medical as well as surgical have been described under Gulm, and chronic absorption disorders where due to faulty digestion that leads to Grahaniroga, and even some chronic diarrheal conditions, and more importantly on the respiratory tract diseases like pratishyay, CAS, and some chronic where immune system is under a dysregulation. In those diseases also this potential formulation has been described under the conditions of Amvat. It has also been prescribed in some metabolic disorders where sthalya, this is a condition condition related to obesity, and as well as kash. The beauty of this product is it is used both in sthalya and kash, and where it is used in kash I will later on explain you. In also in dyslipidemias also it is used, in hypothyroidism and other thyroid morbidities also it is used. In fact, Trikatu is literally Trikatu has been literally tagged as panacea. It is one of the widely prescribed and extensively used for most of the health irregularities. And the name Trikatu, it is itself very simple, descriptive, and scientific, because Ayurvedic herbs have been described according to their taste. Some of the herbs have been described according to their taste and potency also. So this name, the Trikatu word, has also come because of its taste and its potency. So the taste is Katu and potency is Ushnabij. What is Trikatu? This is a churned formulation. For the churned formulation, there are many Aushadhi Kalpa yogas in yoga mentioned in Ayurveda. One is the churned formulation, and it is a dried powder churn, fine powder churn. It is made from the dried herbs of pipli. It is a fruit, marich, piper nigrum, and shunti. This is the dried rhizome of adrak. What you say, the spices. These are the 3 reputed spices also. We use them regularly in your culinary, and they need no mention. It is an exclusive churn formulation. We can see it. It is one of the key ingredients, and it is also used as an adjuvant. It is also used as a prakshep in many other formulation. We have also seen that it is Hingvastak churn, Panchkol churn, Sitopaladi, Chavanprash Abale. Many formulations are there. I need not describe many. It is one of the key ingredients. Why it has been given so much importance? Because you can see this prakshep. Prakshep is one. It is used as a prakshep. Prakshep dravya are those dravya which potentiate the action of the main drug or for the indication which is used. And the important alkaloid piperine is one of the important alkaloid present in the pipli and marich. This important alkaloid is pungent in taste, and it is a potential biomarker. This piperine has been extensively studied for its therapeutic benefits for both in vitro and in vivo studies. So, because being a Kai Chikitsak, when I was doing my post-graduation, we had a TB chest ward in front of a male Kai Chikitsa ward. It was a 80-bedded hospital of TB chest ward. Many multi-drug resistant tubercular cases, we used to deal with them very confidently that the dose dependency of the tubercular regimen was significantly reduced by our treatment. It was an add-on therapy. So I would like to deal that the classical textual references. Trikatu Churna is very frequently prescribed in conditions like Pranava Sroto Vikaras. This Pranava Sroto Vikaras has been explained by Charak, and it includes both the cardiovascular diseases as well as the respiratory diseases. Respiratory, it may be the URTI, LRTI, and other whatever all of you know and well versed, and you need not go into that. And Annavasroto Vikaras. This Annavasroto Vikaras start right from the mouth and end at the anus. So the whole of the diseases that come right from, that begin from the mouth, even it may be the loss of appetite, loss of taste also. Even in those vikaras also, aruchi, anorexia is this Trikatu Churna is prescribed. Agnimandya, Krimi, Grahani, Udara, Atisar, these come under Annavasroto Vikaras. This and Raspradoshaj Vikaras. Charak has used in Raspradoshaj Vikaras. It is the Jwar, where the Jwar is in a chronic type. You have to go for Deepan Pachan, and then he advocates the use of Trikatu Churna, Pandu, Amvat, and Stholjas. These are all Raspradoshaj Vikaras. And even in Medo Pradoshaj Vikaras also, you can clearly find the reference of using Trikatu. Medo Pradoshaj Vikaras we can correlate to hypothyroid disorders as well as dyslipidemias in the current scenario. Now we have experienced a great pandemic in the last 2 years, and there was a hunt for treatment, who will come first with the best medicine in because of the great deaths we were dealing with. And the Ayush Ministry of India has advocated use of Trikatu Churna in COVID-19 infection. You can find it online in the PDF format. It is also available, and I have given the reference. This is given for practitioner for COVID-19. It is in target 2. What do you mean by target 2 patients? It is the uncomplicated cases with Schwas, Kas freedom, with coughing and respiratory distress, predominant cases. How Trikatu Churna should be given? Trikatu Churna should be given as Siddha Jala. It is in the form of a medicated water. It is in the form of a medicated water. How you should be? You have to boil for 5 minutes 3 grams of Trikatu Churna in 1 liter of water. In 1 liter of water for 5 minutes. Roll boil for 5 minutes and then keep it and drink it lukewarm throughout the whole day. It relieves you with coughing and expels the sputum also, and also give you relief in the distress. And it is also advocated in mild pneumonia cases whose respiratory rate is greater than 40, and how it should be used. It is indicated with Dashmul Quad with Pipli Churna Prakshep 1 gram. This is one of the important indications of Trikatu Churna in the pandemic scenario. For Churna precaution, for Churna or formulations, Sharangdar Samhita is considered as a very good text, is the basic treatise, and this is one of the shlok referring to Trikatu Churna. Pipli, Maricham, Shunti, all have to be taken in a equal quantities, and they should be given in dried form. And where it is indicated, it is Deepan Sleshma Medhognam Kushtapeenas Nashanam. The first action is the Deepan action. By correcting the appetite, it increases the absorption of all drugs, whatever you are giving for the treatment, and it is Sleshma Medhognam. It expels the mucus. It is an expectorant and a mucolytic agent. Medhognam Kushtapeenas Nashanam. And it is also used for skin diseases. I will come later on. And penis, chronic, where there is chronic respiratory allergies, who going for rhinitis or sinusitis cases also, you can prescribe it. Jayed Arochikam Samam Mehagulma Amayan. It is also prescribed for Aruchi, chronic anorexia, Amam, Am dosh we can deal later, Mehagulma Amayan. This is one another formulation recorded according to Trikatu Churna from the Ayurvedic Formulary of India. The dose, why it is the Churna formulation has to be given at 6 grams usual dose, but because of its Tikshna Guna and Ushna Virya, and we have to, the therapeutic doses should be limited to 1 to 3 grams per day. And the vehicles of administration is hen, honey and warm water. This is taken from the Ayurvedic Formulary of India. The parts used for these herbs are the fruit of pipli, dried fruit. You can see the picture, the piper nigrum, dried fruit, and the dried, this is one of the herbs, and when it is treated with lime, you can get the shunthi. This is the dried rhizome, that is the shunthi. Pipli is a yogvahi, it is a rasayan. What you can see, this is all the literature regarding the pipli. It is one of the extensively described rasayan dravya in the Charak first chapter, in the Charak Rasayan Adhyay. What is a rasayan? In this rasayan now are classically, now are comparatively dealt with the immunomodulators. Immunomodulator therapy has been used as a alternative to, is emerging as a alternative to chemotherapy. That is a great discovery. We can use it as a alternative to chemotherapy, and the emerging of immunomodulators in this Ayurvedic immunomodulators will be a great contribution towards the cancer genetics, cancer therapeutics. So the main property regarding the pipli described by Charak, it is a yogvahi. Yogvahi is one of the umbrella term, and it has been described, it has many actions, Deepan, Pachan, and this is one of the rasayan. Rasayan dravya always Rasayan Dravya start by correcting the Agni, and it improves the circulation, it improves the enhancement, micro circulation, it improves the nutrient reaching of nutrients to every cell, and thereby cures the disease. So, and it is also a Vrishya Dravya when it fertility enhancer. All the infertility cases we have dealt with that. Before going for shaman chikitsa, it have to be given for Shodhan as well as Dipan Pachar. It is also considered as Vrishya Dravya. And now you can see that bioenhancer is one of the aspects. It is taken from the term Yogvahi. You can see that bioenhancer where people use by the modern medicine as one of the, that it potentiates the other drugs, and it makes the increases the bioavailability of other drug without exhibiting its own action. This is one of the aspects taken from Yogvahi. But Yogvahi described in Ayurveda is it also inculcates the other drug properties and also potentiates the actions of the other ingredients also. And the Charak has used one exclusive term for Pipali, that it is called as Apat Badr. Apat Badr, it is a very scientific term that it has to be used judiciously. Judiciously matlab matravat upcharet. So it has to be given in definite therapeutic doses, and it has to be given for a limited period only. And how you say this will be 1 week time will be the limited period, 2 week time will be the Acharyas has given, Charak has given, the commentators have defined more elaborately that till you get the relief all the acute symptoms, till then you have to use, but not for long term use. It is not at all indicated. But still, if you have to use for it a long time, you have to be very cautious, and you have to monitor all the side effects of the drug. It can also have some adverse effects when given for a long term. We can come later on what will be the adverse effects. And Pipali should be all given with honey. When given with honey, the adjuvants or the co-drinks, when you change, the action will also differ. Pipali churn, when given with honey, it is medokafar, it is mucolytic expectorant and antihistaminic. And Pipali, when given with twice jaggery powder, or it is useful as vajikaran purpose and for Grahaniroga Jiyunujwar. There is one another formulation now emerging as a great immunomodulator or anti-inflammatory is the Chausat Prahar Pipali. Chausat Prahar, it is the Pipali is processed for 64 Prahar, and it is a potent immunomodulator. Its efficacy has been well validated in many conditions of rheumatoid arthritis and gouty arthritis also. This is the Piper nigrum dry fruit, and all the Piper longum, the active phytoconstituent is the 5 to 6% of piperin. Pipali also, in Marich also, it is the pungent taste is due to its piperin component. Piperin has piperidine and many analogs. Chavicin also is one of the ingredient, and it is also Kafvathar. But one of the the difference is it is Ruksh. So it cannot be given for a long time. It may cause skarsh or balnash or shosh when given for a long time. So you have to be very careful when use this. And the primary actions are the Dipan, Pachan, Swedan. It also causes it is a Swedojanak, and it is also a Lekhan and Shroto Shodak. These three actions are very important for explaining the therapeutic benefits. How how Swedan, the vasodilatation it produces wherever it touches, it increases the availability of the active ingredient and thereby acts from here. It is Shwashar, Shulhar and Krimihar according to Bhavaprakash Nigantu. But when you use it for extended period, I have seen that gastritis and urethritis or burning in urine, and sometimes the pimples or the acne spots, burning palms and sores are the reported adverse effects when used for long term and in excess amounts. This is the dried form of ginger we use in Trikatu. The important phytoconstituents are the gingerol and shagol, and the properties are same, but one special property regarding this shunthi, it is a Grahi means it has a Shoshan property. It dries up the excess abnormal secretions secreted by the intestine during the infective diarrheas. Where you go for severe watery diarrhea, then you have to give for the Grahi Dravya, and Shunti is one of the very important, simple and very frequently used Grahi Dravya. It is extensively used in Amatisar and secretory diet. Yes, it is also a highly anti-inflammatory drug and very well validated for its immunomodulant action in rheumatoid arthritis. This is the Raspanchak Siddhant, and Pipali and Shunti are Snigdhin Viri, and but only Marich is Ruksh. The whole formulation can be used as Yogvahi and Rasayan, exhibits Yogvahi and Rasayan properties. So the main actions are Deepan, Pachan, and Rasayan properties. The pharmacological properties can be attributed, the therapeutic benefits of Trikatu Churna can be attributed to three main reasons. The first is the Deepan effect. Deepan effect is the Jatragni is the main, is the digestive fire which is responsible for your health and the diseased condition. So it increases the digestive fire, the Jatragni as well as the Datvani. By it also increases the amount of both the Kapha and Pachak Pith due to its Katras and Ushnaviri. The Pachan effect of Trikatu is due to it acts on the Pitta Dhara Kala, a glandular, a lining, it is a lining that coats the entire GIT, which helps in increasing the secretions, important digestive secretions like the pancreatic juice, intestinal secretions helpful for the digestion of all the nutrients. So it is a great Pachan Dravya, and it also increases the absorption and assimilation as well. If this if this Agni is not there, it will result in Am is, that is Jatranal Dhaurbalyat Avipakvastu Yorasaha. This Am is a toxic product, metabolite. It is just unabsorbable, and wherever it goes, that is, if it remains in the GIT, it causes some diseases like Visuchika Alisak. But if it goes for chronic accumulation, wherever it lodges in tissues, then it may go for creating those tissue disorders, just like Amvat. Wherever it is lodged, it can behave just like a toxin, and then it go for developing those diseases. And people is a Yogvahi as well as Rasayan, Trikatu Churna, and can also be used as a Yogvahi as well as a Rasayan for many indications because of its Shroto-Shodak property. Rasayan drugs are helpful by promoting the Agni, by promoting the microcirculation, thereby producing the Labo Payohi Shastanam Rasadinam Rasayanam. So any technique which increases the health of the tissues, any technique, whatever technique we assume that we get healthy tissues, those drugs are called as Yogvahi as well as Rasayans. It possesses Shroto-Shodak property by increasing the microcirculation and increases the cell permeability to the circulating nutrient substances. Validated pharmacological actions according to modern science. The modern science has studied Pipli for its Yogvahi. We can consider it bioenhancer. It increases the bioavailability of other medicines. Everyone knows that according all the antibiotics, now the modern science prescribes the antibiotics to reduce the microbial resistance. They add Pipli or piperin component to reduce the resistance to that antibiotics. Emerging in topic. And
Sujata ji, I'm going to Sujata ji, namaskar. I'm going to draw your presentation to a close because we are coming to, there you are. You are at the very end. Thank you so much.
Thank you.
Thank you so much for taking us into the...
Sir, a single, sir.
Wait.
A moment, sir. One minute, sir. 1 minute.
Thank you.
Can you give me 1 minute?
Yeah.
Sir, the Anupan has been described for Trikatu Churna. It may be Madhu, Grit, Kshir, Takra or Jal. I have given the indications also. For different conditions, the administration code drinks we administer will offer Trikatu Churna its therapeutic benefits. For Sthal, it should always be administered with Takra or Jal. For thyroid disorders and for Karsha as well as Grahani disorder, it has to be given along with Grit. This is mentioned in classics also. This is one another topic. And the contraindications, all Pittach Prakriti, Garbhini, in pregnant ladies, it has to be very carefully used. And in Grishma Ritu also, it has to be very carefully used. Thank you, sir. Thank you.
Thank you, Sujata ji. Sorry to rush you because we were so engrossed in that early discussion that we lost track of time. Thank you for being with us today. Please tell us about this building. This is in Haridwar.
Yes, sir. This is our college.
Thank you so much. How many students do you have here in Patanjali Ayurveda College?
Sir, we have a batch of 100 students every year.
Very nice.
We have a post-graduation of 60 students per 6 subjects. All the subjects contain PG, and we have 6 students per subject.
Thank you. Thank you so much. I invite all our viewers to learn a little more about the Patanjali Ayurveda College. Clearly, they have, not many people outside India realize the scale and size of our educational establishments. You have a working hospital there too, I guess. How many beds in your hospital?
So the footfall is 1,500 patients OPD purpose, and it is a 200 bedded hospital. And we have recently opened a 2,000 bedded hospital of Patanjali Wellness Center. It is along with naturopathy, but Ayurvedic college is purely Ayurvedic college and Panchkarma unit.
Thank you so much, Sujata ji. Thank you. I wish you had told us a little more about this, but we will try and find out a little more. Thank you for being with us today. We are running out of time, so we will quickly move on to our next speaker.
Just 1 minute, I'll add the Madan, if you don't mind. One point.
Please.
And that is, this Trikatu cannot be complete, the utility of Trikatu, without mentioning about the Vardhamana Pipali Rasayanam. That is one of the important uses of Pipali in a graded way. We use 2 Pipali, which is roasted in ghee and processed in milk, and give in COPD conditions, any conditions of lower pulmonary conditions. So this is a very important thing. We use up to 64 Pipalis, and Vardhamana Pipalis is a very unique, and only Pipali is used in that way. 2, 4, 8, 16, 32, 64, 32, 16, 8, 4, 2. It has got wonderful effect in people, especially with COPD. I have removed oxygen. People who have been using for years by using Pipali.
Thank you so much for sharing such insights into how clearly you come with a lot of experience and you have used this with confidence. And what you say is people with COPD can benefit greatly. Thank you so much, sir. Gigi, please stay with us. Our early discussion was so extended that we are running short of time, but please let us move to our next speaker. Thank you, Sujata ji. If you stop sharing your screen, then we can quickly move on to our next speaker. Sujata ji, thank you for being with us today. Please let us.
Dr. Harish, will you please share Dr. Dhanda's presentation, please?
I think Dr. Sujata has to stop sharing her screen.
Sujata ji, please.
Dr. Sujata, please close your screen.
Gigi, while we wait for the next presenter, Dr. Dhanda Kulkarni, who's the president of the Texas Ayurveda Professionals Association and the board of directors of NAMA USA. Dhandaji, namaskar. Thank you so much. Dhandaji, thank you so much for being here with us today.
Namaste. Namaste.
Namaste, ji.
I did have a technical difficulties locating my presentation.
So he's has your presentation and she's loading it up.
Yeah. Let me get started. Looks like I'm going to be the showstopper here. Thank you, Dr. Madanji, Dr. Pallavi, Dr. Deepika ji, Dr. Gigi, and most importantly, my very favorite guider, mentor, and a lot of things, Dr. Harish ji, for inviting me on this platform. And if you could do the full screen, Dr. Harish ji or Pallavi ji, that'll be great for the presentation. So I think Dr. Sujata ji did an excellent work on pulling all the pharmacological aspect of it. And I'm going to summarize the pharmacology and therapeutic effects here, and which is very interesting that Dr. Gigi has mentioned Pipali, and we also call it Sausashta Vardhamana Pipali. Sausashta is 64 in Marathi language, 64 times in upgrading. Pipali is one of the rasayan, but Trikatu is a part of a three very beautiful combination, and we have to really congratulate our ancestors' knowledge from our scriptures that they have done these ganas for us. And today this is sound to be a very advanced technology in finding the research. While I was really searching all the therapeutic aspect, here is what I found. I found that the ancient documented Ayurvedic Materia Medica, which is date back in 6,000 years BC, mentioned more than 370 formulations of Trikatu. Out of that, you will be amazing that 270 all the formulations has Trikatu as their ingredient, and out of that 50 has a main ingredient of Trikatu, which has been published in Indian Journal of Agriculture and Allied Sciences back in 2015 research paper. I'm very glad that I have so much vast audience on Facebook as well. I would like to acknowledge and would like to take the Trikatu knowledge to their level in this presentation. So this presentation is mainly going to highlight Trikatu as not only a household herb, but also as a very scientific knowledge in the research arena. More than if you go on to PubMed and other scientific research platforms, today you will find more than 50 to 70 studies, and I'm going to walk you through with those I find really interesting to share with you all. Okay, so let us talk about a little bit Ayurvedic traditional reference. I'm going to do this in a three-part. So first part, we're gonna go how the Ayurvedic traditional references are going to look. Then we're going to do the whole biomedical science preview on it, and then we're going to bring the bridge together. Make sense? Okay. So here is Trikatu has been used more in the treaties and Nighantus with the one name as a Trikatu, but many times has been used synonyms as a Katutraya, Vyosha, Trigantum, Triktagutam. They have a Varti, they have Gudam, they have Kwathas. No matter how many pharmacological different chronological order as a Swaras, Rasa, Kashaya, all of it is been extracted from the Trikatu, and most importantly, today's household used as a spice, or we can also use as a churna. Nowadays, it has been used many times as a churna. So next slide, please. This is one that we all know. Individually, if we talk, that what Dr. Sujata mentioned is basically Trikatu is 3 different herbs, and the very important herbs is Shuntha, Marich, and Pipali. Shunthi is nothing but your dry ginger powder. You can make it at home for all the listeners out there. Then you have a black pepper, which is on your kitchen table, and you have a long paper. Long paper you will find in a Ayurvedic or other setting where you have a spice rack in the other areas, which is also called pipali. So there's a lagu pipali and there's a bruhat pipali. From that we use here both sometimes, and there's a bruhat pipali and lagu pipali mentioned in our Ayurvedic textbook. But here is what it uses as individual. As Dr. Sujata went over this, I'm not gonna spend much time, but I'm gonna spotlight, previous slide please, sorry. I'm going to spotlight the uses for my listeners here. The dry ginger properties is mainly used as analgesic. We all know that everywhere there is a pain, there's a vat, there is a ginger. Ginger, also called Vishwa Bheshaj or Maha Aushad. There's a reason why Charaka says it is a Vishwa Bheshaj, is because all the universal alignments, there's no such alignment, Charak says, cannot be cured by ginger. So make sure you get that. And there's an enlisted uses of those. Then black pepper, which is a pipali, is a stimulant carminative. Pipali, like Dr. Gigi mentioned, both the pipalis are very important, and you will learn their extract. Crude extract of those has been used in today's as a bioenhancers and biopotentiaries into the today's modern world for prescribed drugs as well as nutraceuticals and phytonutraceuticals. Next slide, please. Thank you. So what is we learn all these three things, but what is that Trikatu do? You common man would say, tell me why should and how should I use it? So simple in the summary, here is what Trikatu together as these three miraculous pungent drugs is also called three peppers, also called the herb that balances. What balances? In Ayurveda, something called Agni has an extraordinary importance in the treatment of Kaya Chikitsa, and we'll walk through that. So what does this Trikatu do is a big breakthrough all this ama, the accumulated mucus in your body. We live in a very fast-paced lifestyle here, and we eat fast foods, we think fast, we need instant everything, we walk through and go through with our diets and all. We needed to balance our nutrition by enhancing our Agnis, and this has been well thought process back in 10,000 years to give you something that could be balance your Agni. So here is the pharmacological depth. Mainly this Churna targets your digestive system, your respiratory system, your lymphatic system, and your circulatory system. And we will walk through many of those indications. With the doshic effect, it works on all three doshas. And many of my Ayurveda lovers out there, they know what is Vata, Pitta, Kapha, so I'm not going to go in detail of that. Let's drive yourself into looking Brihattrayi. Those who don't know what is Brihattrayi is Charak, Shushrut, and Vagvat, very old treatise of Ayurveda. So what does the Charak says? Charak is mentioned many synonyms of Trikatu. He has described Pipali, Marit, Shunti collectively as classification in Shula Prashaman, and which is an antispasmodic, which also has a mention as a Mahakashayam Dravya. He didn't mention much pharmacological part, which came into the medieval era of the Sharangdhar and all. But what he did is he also prescribed it in Agnimandya, and mainly a drug, so-called treatment drug, or you can say first choice of drug for anything which is pranavaha, annavaha, and it is also in anna paniya Anya Pani Vigyaniya Adhyay. Next slide, please. Here are these many yogas. You will be fascinated that many research has been done, and last year's classical review, critical classical review published this, and I'm very fortunate to come across to this particular research paper in the ResearchGate that mentions all of these and compiles all of the yogas and the formulations that you could know from Charak Samhita. We don't have to go really do, but if you look at its Gulma itself, Grahani, Pandu, and Kasa Shwasa, and Panchachika has all of these yogas has a main ingredient Trikatu. Next slide, please. Sushruta. Sushruta is another very important Samhita in Ayurveda, who is a first surgeon. So Trikatu has been explained in the Vargas, the classification as a drug. As you could see, he has mentioned and indicated Trikatu in a Mahakushta Chikitsa, leprosy, Udara Roga, Shofa, Prameha Chikitsa. He is not only telling Trikatu as a part of the all these diseases, but also saying that it is a pharmacological drug which breakthroughs the Medo-roga, and main indications and more Vargas has given Twak rog and Medo-rog, where all these ama and mucus has been an issue or the root cause. Next slide, please. Also in some of the toxic related surgeries, Trikatu has been used as a bioenhancer for giving its own purpose as a yoga vahi. Sushrut Samhita mentions 3 important formulations which in today's world we use also a lot as a Hingwadi Churna, Manilya Churna, and Maha Vajrantak Churna, Taila. So Ashtanga Hruday now is another one. We also mentioned Vagbhata is a very new age Samhita, and one of my favorite one. He has mainly collectively said that the Trikatu has been used as a Dipana Pachana. Trikatu is very commonly used in Udaroga, Gulma, Swarabheda. The yogas for those is enlisted as these many. Again, Gulma, Udaroga he copies, but gives you more yogas prescribed in Ashtanga Hruday. Next slide. Let's dive into Nigantus. Nigantus come after the Brihattrayi as a midwival area. It has been mentioned in many different Nigantus, as you could see. Dhanvantari Nigantu make the Trikatu as action as a Vata Shleshmahar, which is a Vata Pitta breaking Vata Pitta imbalances, Agni Dipana, increasing your appetite, Shulahara, which is a pain relieving or antispasmodic as well. Sorry, can you go back, please? Great. I'm not even that fast. I was like working on it really with my pace. Thank you. Bhav Prakash Nigantu definitely uses the action of Dipana Pachana, but one of the important part in Bhav Prakash Nigantu found as a Prameha Nashak. 3 important pharmacological preparation I found while searching on Bhava Prakash is one of the is Gutika used in Apasmar and also used in other Vataj roga. So Triushnadi Gutika has been used. Second, used in the all kinds of a digestive disorder, which is Adman, Vishtabdan, Ajirna, Agnimandya. They have used something called a Triushnadi Varti. And many of the ingredients, there are a lot of 60 to 80 ingredients. The main ingredient is Trikatu. What they do is they make a Varti, which is a suppository, put it to your anus, and it works very best in those disorders. This is a Bhav Prakash Nigantu. Kaidev Nigantu, just explain it into the Aushadhi Varga. Madanfar Nigantu, explain it into the Shunthadi Varga. And Raja Nigantu, which explains into Mishraka Gana. Next slide, please. So this is a summary of what pharmacotherapeutic classification of Trikatu you would find in each of these together. Next slide. Let us dive in. This is a great compilation on looking what disease and which of the treaties has mentioned it or not, but you can see more than 50 diseases. I just enlisted here 23 for the time being, but more than 50 diseases itself has evidence notifying that the Trikatu is the best line of a treatment or a chikitsa sutra in all of these diseases. I would not like to go every on those, but yes, if anybody wants the Sanskrit definition of these diseases to be translated into today's world, they can contact me, or we'll get back to them again. For the Sanskrit names, we are very familiar in Ayurvedic terms. Pandurog, Atisar, Kushta, Ashmari, Visha, Shotha, Stulya, Shlipad, Pinas, Prameha, whatnot. Next slide, please. So now we will dive into our second part of it. We finished the first part of looking how it is look like Trikatu being into that world of treaties or the books. Now let's take a look into how we are bringing this knowledge of all of these scriptures to the pharmacological evidence in today's world. So when there is an number of research, but when you look at the systemic review of individual herbs that Dr. Sujata mentioned to you, I would like to mention to you that some of the bioflavonoids and nutraceuticals work in the systemic review is three ways. One is we know that how we use it, a traditional use. The one is a phytochemistry, which is used in today's diet, and herbal supplements. And the most important that people are looking to use Trikatu into pharmacological activities. And these are the enlisted. They are anti-inflammatory, analgesic, antioxidant, antimicrobial, anti-cancer, anti-Parkinson, anti-stress, nootropic, anti-epileptic, anti-hyperglycemic, hepatoprotective, anti-hyperlipidemic, anti-platelet, anti-antagonistic, immunomodulatory, anti-arthritic, anti-rhinitic, anti-ulcer, anti-asthmatic, and anti-rheumatic, and anti-amoebic. One that is not listed here, which I found early today morning, was anti-helminthic, which is for the Krumi, and which has been a very best research paper. Next slide, please. So this is our third part. Now we're going to dive into today what has gone into Trikatu. There's so much work. I'm very fascinated to share with you that what I found. Trikatu has been proved into many therapeutic and pharmacological studies as a polyherbal formula. Let's dive into it. The first one, important one, which is just study published in 2022, is Trikatu best for flu-like symptoms and COVID-19, and it has found that it has been a best narrative review I have read, proves to be anti-inflammatory, anti-dyslipidemia, which is the higher lipid profiles people working on, immunomodulatory, and that could be the combating result for the flu and illnesses. Mainly, Trikatu powder management into milder cases of COVID-19 got successful, but the study findings show that it could be a potential double-blind rigorous study should have been done, and the trial needs a bigger larger sample patient era for the better validation. So we could say that it has not it has not just proved to be best, but also because of the flu-like symptoms come from Agnimandyas and other AMA disorders, the immunomodulatory action has worked best. Next slide, please. So one of the fascinating Trikatu evaluation I found is all kinds of bacterial infection could be Trikatu could be the answer. So I just wanted to mention it gives me immense pleasure to share this knowledge that this study has gone through every single ingredient of Trikatu, went through all of these tests and found the best bioflavonoids and nutraceuticals, which is Enterobacter aeruginics, which also means that any bacterial ERNA, which includes Salmonella, Streptococcus, and other bacterial type agents, has been caught and engulfed by the Trikatu's actions on it, and it has been proved that the antibacterial activity of Trikatu is much larger spectrum than the in the comparison study with the other antibiotics as well. Thank you. Next slide, please. So another, as Dr. Deepika mentioned earlier, that Trikatu has been populated as a bioavailability enhancer. And there is something, bioenhancers from the mother nature and their applicability in the modern science has been a rocket science. I tell you, everywhere the diet supplementary people and other people where they are developing drug development process, they're finding Trikatu as work as aspirin, or Trikatu works as not only the blood purifier, blood circulation enhancer, but also the synergetic aspect of it. So there is a bioavailability needed for many reasons, and this has been proved not only pharmacologically but in our traditional as Ayurvedic science also. First, bioavailability has been researched and proved it to the mankind in 1929 by Bose, and this bioenhancer is nothing but the agent of enhancing the bioavailability and the efficacy of a drug with its co-administered without any pharmacological activity as its own, and that therapeutic dose has been used into the consequent molecules with the drugs. And because the 60% of the dose has if you go to the next slide please. Yeah, this is the study that proves the bioavailability of the Trikatu into the other drugs. So Trikatu has able to reduce the drugs like rifampicin, amikacin, ciprofloxacin drugs, and there's an ingredient called in this study is piperine and quercetin, which considered to be scientific breakthrough to reduce, not only reduce the dose of such pharmacological drugs, but use the modern science with our integrated Trikatu knowledge to test Ayurveda and modern science research together, which develops and reviews the potentiality of this combination and further proves that the reduced dose of these other drugs over the consumption of the Trikatu, and the study is excellent. You can go and really enjoy the study. Next slide, please. So let's come to the conclusion. After seeing you and walk you through from probably 10,000 years till today, I feel this is what we should narrow down. This is what we have in our hand. What is Trikatu used for? Trikatu used for constipation with mucus, loss of appetite, indigestion, gases, common cold, irritable bowel syndrome, IBS. We have asthma, PCODs, we have gout, high cholesterol, wherever there is ama, wherever there is a Srotas obstruction, wherever there is Agni, there is a Trikatu going to work. So imagine every cell has Agni. And going to that pharmacological and remedial activity, I have walked you through. This is a remedial activity. Even a household person would like to use Trikatu into their diet, into their daily supplemental as a combination. Only one important caution I wanted to mention here for my common listeners, that don't use without advice from Ayurveda doctor, because Trikatu could be very high in ulcerative colitis, or because of its pungent and hot nature. Okay, so last but not least, this my slide will prove why Trikatu is so important. Have you imagined in Ayurveda everything is about Agni? Sarve roga mandagano. Also in spiritual world, we Lord Krishna says in Bhagavad Gita, aham vaishwanaro bhutva praninam dehamashrita pranapana samayukta pachamanyam chaturvidam. What does it mean? Chaturvida Agni, the 4 types of Agni is a main Agni. Because of Agni, only we have the existence. Now today's world proved that every cell has its own Agni, which is their own nucleus, and in own nucleus there is a own ATP production and all of that happening, which is ultimately nothing but Agni proving. I'm not finished with the previous slide, please. Thank you. So what does this mean? Agni bring out your longevity, Agni bring out your complexion, and Agni brings out every tissue formation. Agni brings out your whole life being together. So what does Charaka says is Kaya Agni Ramshaha Jatara Nalaha Amsha Bhagaha. In the tissue formation, what happened in the end process is rudimentary of these bioenzymes that are present when enhanced, the drug that increases the Agni is to be subsided and developed as a cytokinic properties of that cellular level, because that cellular level has a Agni, and that's where Trikatu also going to work, which liberates more heat and balances your BMR. So beginning of my presentation, I told you that Trikatu is nothing but a balancer of your life. What is that balancer? That balancing is your Agni, is your biological innate heat, and that has a lastly, I want to give what my guru taught me how Trikatu works is, of course, you can go and see, this is a summary what Trikatu is, but I give you a new vision today. And I also wanted to tell you that how Chinese, I'm relearning everything, and I'm doing my PhD in Chinese medicine and master's in public health. I will be soon doing that. I would like to share just one thought before I finish. Sarvasya Panchamaha Bhutatmakat. My Guruji, Dr. Prata Joshi, taught me that Sunta, which is a ginger, work in the Amashay. Agni in Amashay is a Jatara Agni. Sunta from the Trikatu works there. Then Miri, which is a Piper nigrum, and that works in your Pakwashay. Pakwashay is nothing but your large intestine. And the Pipali, which is a Piper longum, works in a Pranavastrotas. Previous slide, please. Pranavastrotas, which is your respiratory or your lungs or the main organs there. So what happens when you have these all Trikatu together? You are targeting every single main Agni to enhance, and that is called the metabolic enhancer. You are increasing your metabolic activity, which is the common need for everyone today, to do the weight reduction program, to bring out, balance your cholesterol, to look your skin better, and all that function of Agni does, that enhances by Trikatu. So now you know why Trikatu is called as a miraculous Pinaka breakthrough for all kinds of diseases. And this is where I say thank you to all of you. Namaste.
Thank you, Ji. Sorry to have rushed you here, but you have given us some very, very fascinating insights, your comparisons and your material you've drawn in from the different Nigantus. I can see Gigi, our senior mentor here, is fascinated by what you've shared. And I hope we can bring all of us who are here together into another event where we can discuss.
I will just talk 1 second, Madanji. I forgot to mention that there is a new study with the Trikatu being in the Chinese formula that is called Eugene. Eugene, a recent study for the lower back pain, works on Trikatu, and UJ1 is a escape restraint pill that they have designed in terms of their pathophysiology for breakthrough is a stick stagnation. They use a chi, blood, fire, food, damp, and phalgum. And that combined with the Trikatu has enhanced the bioavailability of their herbs in the chronic lower back pain. And that presentation and that the study has been published in Acupuncture Today magazine, which I came.
Danaraji, we are very fortunate to have you here with us because you represent one of the largest organizations, Ayurveda organizations in North America, NAMA. And we would like to see how we can bring all these organizations together, perhaps, and base some longer and more detailed interactions, perhaps at Ramaya Indic Studies Institute, where Gigi is. Canada would love to be there. India, of course, will be there. NAMA, we would like very much for you to be there and to discuss in greater detail all these points. Your review today, your interest in interactions between Ayurveda, Chinese medicine will all come in very nicely. So this is a request to all who are viewing us here on the Zoom platform and on YouTube, and also a request to Gigi to bring us all together in Bangalore at the Ramaya Center. And perhaps Gigi can comment on that before we draw this to a close. Thank you, Gigi.
Thank you, Madan. Yes, I'd like to bring together, especially on this concept of summative medicine, which we have been propagating for last some time. And I think there is a need for an international kind of collaboration to enhance the activity of Ayurveda. Only one point I want to mention from last speakers, that Prabha Joshi, her guru, told a very important thing which no one has quoted anywhere. Once the Shundi working in the Amasya and Pipali and pepper working in the large intestine and Pipali working in the lungs and respiratory areas. It's a very important marker. No, it's a very important thing from only a Ayurveda Acharya can tell anyone, which is not in the textual thing. And if you go to the Dravyaguna of Trikatu, you can see this is very few Dravyas are there, which is having Ushna Gunatam along with Snigdhatam. Snigdhatam and Ushna Gunatam is a very contradictory gunas which are in one plant. That's why there is one of the three ingredients having Ushnatam and Rukshatam. There are other two having Ushnatam and Snigdhatam. That's why this is able to do work as a Rasayana, is able to work as a Yogavaki, this also work as a Vardhamana Rasayana as a Srodha Shodhaka. Wonderful Srodha Shodhaka. You can remove complete kapha, you can scrape it out. So if you know this combination, you can do wonder with that drug. And Trikatu is normally in Kerala, they're saying that without Shundi, there is no kada. Jobi kada have to add Shundi to that. That then it will become, that means bioavailability. So this kind of conceptual understanding of Ayurveda will take you to further combination, further innovations. So it was very, very nice hearing all of you.
Well, we are very lucky, Gigi, that you are here with us today and listening to the quality of our presentations. And most of all, thank you for offering us to think about summative medicine and an opportunity to come together at Ramaya, along with all of us here, Deepika ji, yourself, senior people, Pallavi ji, sitting in Bombay, will bring many people, and let us all come together in Bangalore. We can do it.
Dr. Madan, I have a question to ask to both the speakers. In Marich, they have mentioned pramati, the word pramati. So is it like relating to remove all the srotorod from the channels, from the body
This is also
channels?
for Gigi's, perhaps Gigi, you can also comment on this.
Pramati. And also they have said when Sunti, the wet ginger has to be made into dry powder, that is Sunti, it has to be rubbed with bans, the sharp bans is the bamboo shoot, with that it is rubbed. So maybe that also, the Vanshilochan properties also descend in Sunti.
Thank you. I don't know if there is somebody, perhaps Gigi would like to comment, perhaps our speakers would like to.
See, actually, Pramadi is an epitome of Ushnatam and its action. Pramadi becomes, that medicine has to be used very carefully. That's what it means. It can open up, it can even create bleeding in the system if you don't properly use. That's what Pramadi means.
Right.
And second thing is, Pramadi is we have got the two important aspects in Ayurveda to understand pharmacology. There is a Amshamsha Kalpana and Taratama Bheda. If you take any rasa, see, ghee also is madhuram, sugarcane also madhuram, rice also madhuram. But madhuram is not a single entity, it is a taratama bhedatam. That is what 63 combinations are told for each rasa when it can multiply. That's why each dravya is different from one. So if you understand the taratama bhedatam and amsha kalpana is another pharmacological factor we use in Ayurveda to understand pharmacological action. Amsha kalpana means how each of the guna and rasa and karma work in a graded way. So only the acharyas of great understanding can understand. That's how we divide. When we want to give a Ingoshtaka Churnam, where we have to give Ingojadi Churnam, where we have to give Trigudu only. This Taradama Bhedatam can be understood by the essence of Ama and system. whether ama is entirely covering the body, or ama is located only to the lungs region, or ama is only in the upper region. So all these kinds are done. If it is upper region, we give Trikatu more importance to work on that. When it is down area, Trikatu along with other things, Panchagola has to be added. That's why you got Panchagola, which is a extension of Trikatu's action. So this is what I mentioned in my introductory remark, that how you understand Ayurveda is very important to take Ayurveda further. And coming to the Vamsalojana point, see, Vamsalojana actually forms in a bamboo only in 50 years of
50.
Actually, this is the last stage of bamboo, only Vamsalojana. So very rare, it is kind of a silica. And by rubbing it, it doesn't, Vamsalojana may not come, but some of the aspects of bamboo can get into it. There are many processes, many methods of processing, converting Sundi to term, this Ardharak to Sundi. There is a process.
Thank you.
Thank
It is
you.
not
Thank you for
plain
being with us
dry
today.
leaf.
Thank you for your insights. Thank you for sharing so much. We do want to continue this discussion. It is enriching. We are out of time, but we have taken up your offer, Gigi, of hosting an event or a series of events, or perhaps a program like this at Ramaya with your help and guidance. I will discuss this offline. Thank you again. Thanks to all for being with us today. Pallavi,
Thank you.
Yeah. Thank you. Thank you, Dr. Madan, Dr. Harish. I would really like to express to the viewers how these simple spices or these medicinal herbs can be of such profound benefit to us in our bringing about harmony in the body. So with this, I would like to just make a few announcements. We have been conducting these lecture series every Sunday, but henceforth we will be conducting these lectures on alternate Sundays. And the next lecture is going to be on Arjuna Rishta, that is Terminalia Arjuna, which is again a very important topic. I hope I express that all of you all must attend and join us. So with this, I would take the pleasure of thanking all our dignitaries here. First of all, seeking Lord Dhanvantari's blessings, I would like to thank our special guests, Dr. Gigi Gangadharan and Dr. Deepika Gunwanta, for spending their precious time with us. Our expert speakers, Dr. Dhanda Kulkarni and Dr. N. Sujata, you all both have been very excellent and bringing out the profound knowledge of Trikatu. Thank you so much for sparing your precious time. With this, I also thank our collaborators who have brought us on this platform to join and share knowledge. Our special thanks to Canada-India Foundation, Consulate General of India in Toronto, Canadian College of Ayurveda and Yoga, where Dr. Harish Vermaji is the main person, Canada Ayurveda Practitioners Association. Thank you all for your immense support. European Ayurvedic Association.
Pallavi ji, namaskar.
I think I have lost you all. Anyway, thank you. You can hear me. I just want to thank the viewers and my thanks to Tathastu, Pravasi Television and Y Media, and to main thanks to our family members for sparing us on a Sunday. With this, I look forward to see you all on 2nd October for attending Arjuna Rishta, a talk on Arjuna Rishta. Thank you very much. Enjoy your Sunday. Bye-bye.
Bye-bye, Pallavi ji. Thank you. Namaskar. Thanks to all once again for being with us. And we see you again on the 2nd of October.
Thank you.
Namaskar.
Namaskar, sir. Namaskar.
Namaskar.
Bye-bye.
Bye-bye.
Okay, you're right.